everybody joining us for this joint webinar between Grantmakers for Education and Early Childhood Funders Collaborative. We know this is a hot topic because we've been hearing a lot about it. And I think, Celine, I'm going to ask you to say some welcoming words first, and then I'll go over our agenda.
Yeah, thank you all for attending. My name is Celine Coggins. I'm the Executive Director of Grantmakers for Education. I am mostly on the line to learn and hear what you all are up to, and feel very grateful to be able to participate. And that's all that I have to say, and I'll throw in questions where it makes sense because I have lots of them.
Great, thank you. And I just want to say on the part of Early Childhood Funders Collaborative, we really appreciate the partnership with GFE that we've developed over the past couple of years. It's a really nice complementary way for us to get early childhood content out to a much broader array of education funders and also to learn from GFE. So we really appreciate that. So today's topic about emergency funds in the early care and education sector is really one driven by what we see happening in the field, which is we see a lot of these kinds of emergency funds starting. And you'll see that we have on our website a list of the ones that we know of. And if you know of more, you can let us know. We'll tell you at the end how to do that. And I think that there's a variety, right? Now, the ones that we've chosen to highlight today are funds that are specifically targeted to early care and education. There is probably another subset of community foundation and other funds that will have some participants who are early care providers or families with young children. And I've got to say that I think that most of these are local, but what we're highlighting today is two kind of local/state examples. I think in the case of Minnesota, there's a statewide approach. And then two national funds that are getting at very specific parts of the population that might be otherwise left out. And among the things we'll hear first from our two local funds in Philadelphia and in Minnesota, and then we'll hear from our national funds, the Homegrown Fund and the National Domestic Workers Alliance. And we've asked them to cover some basic information about who they're targeting, what they're hearing from applicants, and those kind of things. And then I'll ask a few questions, and then we'll open up for questions. It was not our goal to cover all the emergency funds and all the different ways that they can be used and all the report out. More to take a sampling and to discuss some of the issues that are coming up by having what might be considered a somewhat representative kind of exemplars of the funds. And we also hope that when we get to the discussion part, we can talk about, and maybe folks will be able to touch on this a little bit in their framing and in their beginning presentations, the benefits and limitations of this, right? Because one thing ECFC is, and all of our funders have said consistently, is what it's going to take to recover any sector, but especially the early care and education sector, is going to be public funds. But they're at the same time, and that's why advocacy is really important. And our first principle, or maybe our second principle on our website is advocacy and direct service. And so we know that, but at the same time, you know, there are some responses that bridge people over to the time when those are going to be available while we figure all this out. And so hopefully we'll dive into that a little more in the discussion. But first, it's my great pleasure to introduce—
You need to buy food?
Oh, we're going to have to mute.
I should have got some today.
Hold on, I'm going to take a brief minute and see if I can figure out. All right, I'm muting everybody. And then we'll ask our speakers to unmute. So I first want to turn to the Philadelphia Emergency Fund to Stabilize Early Learning. I do not know how they pronounce this acronym, so maybe that's one of the first things they can tell us, because it makes an unusual acronym. And we're going to hear from Elliot Weinbaum, the Program Director at William Penn Foundation, and Rashonda Perryman, a Program Officer at Vanguard, who I should say is also on our ECFC Steering Committee. So Elliot, unmute yourself and take it away.
Great, thanks, Shannon. Yeah, the acronym, the name got a little mixed up there, but it's
Philadelphia Emergency Fund for the Stabilization of Early Education, and it's a catchy PEFC is the way that we're pronouncing it. In any case, thanks very much for including us in the conversation. I just want to make a few comments sort of overall about the establishment of the fund, and then turn it over to Rashonda, who will talk about more of the details of it and share those with you. So first of all, just a word about the creation of the fund. On March 12th, Vanguard reached out to us at William Penn, knowing of our shared interest in early learning in Philadelphia, and sparked the conversation about what we should do to respond to a rapidly emerging and increasingly terrible crisis. So we met on March 13th. That was a Friday. On the evening of Monday, March 16th, we convened several phone calls with early childhood stakeholders and early childhood providers. By March 27th, we had the funds approved by our boards, and by April 6th, the online application was live. So in about 3 weeks from initial idea to full funding and online application, which I think speaks both to the urgency of the situation, but also builds on a foundation that we and Vanguard and others in Philadelphia had been creating for years. And so I just want to touch on what some of those variables were that I think allowed us to create this fund quite so quickly. The first is good data, and we've been building childcaremap.org is sort of chief among those for the Philadelphia area, data about supply and demand, about the geographic distribution. We have a project called the Fiscal Hub that has been collecting financial data about early childhood education providers in Philadelphia, and working with the local R&R, we were able to get good data about the loss of co-payments that would be affecting childcare providers during this closure. So all of that was super helpful for us in designing, figuring out the scale of this fund. There's a lot of data we don't have, for example, how we're doing on equity issues, race and income of providers that would help us to target this fund even more strategically. So we're using this moment to collect some of that data, but so combination of data we did have and data we didn't have that's informed this. The next thing I would talk about is the infrastructure that William Penn and Vanguard have been sort of building over the years. So this emergency fund is a part of a bigger structure. It is not the structure in itself, and I think it's important to remember that. That infrastructure includes things like a fund for expansion of quality early childhood, a revolving loan fund, a fund for curriculum updates, a fund to sustain high quality providers. And many of those funds have been either created in partnership with or have some role for Reinvestment Fund, the local community development finance institution that is the host of this emergency fund. And having the experience and expertise based at Reinvestment Fund allowed us to act very quickly to create this fund. And finally, I would say it's the product of building good relationships and cultivating those relationships over the years. It's not the first time that any of us have worked together, and many of us collaborated on some of that infrastructure that I talked about a moment ago. So we were able to schedule those calls and took the input from the early childhood education providers and sector leaders very seriously in creating the fund, and the fund Rashonda will describe is very reflective of what we heard in those conversations. And those relationships really let us sort of trust one another, understanding that to move at this speed, there are some details that are inevitably going to have to be worked out as the plane is flying. And so the trusting relationship allowed us to agree on what those would be and how we would work them out. You know, all of that investment over the last 5 or 6 years has added about 10,000 high quality early childhood seats to Philadelphia's supply. It's increased from serving about 25% of kids in Philadelphia to about 35% of kids in Philadelphia in 5 years. And this fund was created specifically to preserve those accomplishments so that we didn't lose ground in that kind of, with that kind of momentum during this crisis. So I'll turn it over to Rashonda to talk more about the fund itself.
Nope, you got it. We can't hear you, Rashonda. And you're not muted on our end. No.
Rashonda, roll your mouse down to the bottom of your screen to the left, and on the mute button, the little arrow to the right of it has a check your sound settings option. We hear a little static. It sounds like it's starting to.
It's something's coming through, but it's all garbled. Do you?
That better if I just talk?
Yes.
There you
No,
go.
now you got it. All right.
Got it. I'm gonna mess up my hair, but whatever. All right, so I'll try to talk as loud as possible about since I'm off my headphones. So the fund, Pepsi, we initially set it up with about $7 million from William Penn and Vanguard, and we are now sort of in the next stage of that, and for us to really intentionally look for other funders to add additional dollars to the pot. As Elliot said, or sort of got to, our main goal is really to preserve the gains that have happened in the sector. So when we thought about this emergency fund, we really thought about that, right? We were able to react quickly because we made these gains and we didn't want to see them fall by the wayside. You know, I'm sure that others will get to this and we can certainly talk more about it. We recognize that, you know, over the course of this crisis, all kinds of things are going to happen. We could have thought about this differently, but we immediately, our gut was that we didn't want to see these gains sort of fall out of the sector. So providers can request assistance in a couple of different categories. One, the first category is really around sustaining their basic expenses. So rent, paying staff, utility bills, those kinds of things providers can directly request funds for. The second category is supporting new methods of helping families. So diapers, supplies, caring for children of essential workers, providing temporary enrichment opportunities while their children and families are not in their settings. If providers are thinking of new ways to be of service, they can apply for those. And then the third category that they can apply for that we aren't sort of looking at right now, but we want to sort of have it close to hand is any reopening costs. So providers can apply here, but this isn't a priority area. Not right now. As things get further and we sort of see what things work out, this might turn into, or this could certainly shift, but like what a reopening looks like. So cleaning and sanitizing spaces, updating health and safety, training for staff, purchasing new perishable items, those kinds of things that we know will need to help providers get back sort of serving families. That's that third category. And I'll also add here that we had been thinking before this crisis happened about what nonprofit business repositioning in early childhood looks like. So we asked the question on our application specifically about recovery, and as providers think about recovery, what is merging and acquisitions and thinking strategically together look like and feel like for providers. So we asked a question about that on the application. If we have providers who feel like they might want to merge or might want to start having serious conversations about it, we have a place to route them with a different fund. Eligibility, early learning programs who are serving children birth to 5. They can include childcare, family childcare, pre-K, early intervention, and home visiting programs. We particularly want to call out home visiting because we had lots of folks who sort of said to us home visiting often sort of doesn't find their way in the pot. So those services who are providing home visiting can also pull down dollars on this. Recipients, we are using a scoring rubric that includes sort of priority of points. So providers have to demonstrate high quality, they have to participate in state teacher development, or demonstrate high quality as measured by our STARS system, or using some evidence-based model, the home visiting program. They can participate in a state, like a teacher development program like Teach. They can be receiving CACFP. They can be any of the number quality improvement programs or initiatives that are happening. They can be, they need to be serving primarily families with low income. operating in communities with some sort of known shortage. And, we're asking folks to be able to state that they will be continuing operations when they are allowed. Obviously, nobody can look into the future, but we are asking people, if you're planning to get out of this business, don't apply for these funds. As much as possible, we're trying to sort of ask those questions. The last thing I'll say, because I don't want to spend up too much time, is that there are a couple of other points there, but we had a rubric, again, to Elliot's point. We've been working with the Reinvestment Fund long enough at this point, which is our CDFI, long enough at this point where they understand the types of providers and the types of questions to ask to really get at the right group of providers who should and could use these dollars. So we are, for a big degree, sort of trusting their instincts around this. So finally, there is a small portion of the dollars that will be used to support sort of sector-wide efforts, and it's already been used to set up a hotline for providers to get individualized assistance on applying for federal and state loan programs and legal advice as related to HR cases and issues or any other topics. So when we think about sector-wide, these dollars are being applied for by individual providers, but we recognize that there are some things that are going to be across the sector, and maybe it's much easier and much more efficient just to get sort of a pot of money to a group or an organization to do a sector-wide approach. And as those ideas come in, we are sort of sending them through an advisory group that we've set up. Another idea that's been on the table is working with one of our local umbrella bodies for a homeless shelter who works with early learning programs. So how do we sort of think about them not just as individual shelters, but as a sector supports for homeless children and their families who are in early learning. And I'll just mention one more time that the fund is set up to really meet immediate need. There are a host of other supports that Elliot went over, and those are to really address long-term sustainability. And we'll be looking at how we can make adjustments to those things. And of course, really trying to use our portfolio in a COVID-informed, responsive way as we move throughout 2020. And I'll just stop there.
Thanks. That was really interesting and really helpful to hear how this both built on work you had done before, and that you have a ramp where it will feed back into the long-term recovery, and that you're thinking of that whole trajectory. So that was really helpful. And so next we want to turn to the West Central Initiative Emergency Childcare Grant Program in Minnesota. And we have Nancy Jost, who's the Director of Early Childhood for the West Central Initiative, to tell us what's going on there. And quite a different, I think, geography than Philadelphia.
We are totally rural. So West Central Initiative is one of the 6 Minnesota Initiative Foundations. We're called MIFs. And we cover the entire rural parts of Minnesota. And in West Central Initiative region, we have 9 counties and the White Earth Nation. And we have built kind of a informal/formal system that we fund and facilitate. Each of our counties in White Earth has an Early Childhood Initiative Coalition and coordinator, and they meet individually in each county in White Earth 10 times a year, and then they meet together in our office 6 times a year. So we do lots of work on pre-K to grade 3, childcare, social emotional development, oral health, all sorts of things. We have a regional oral health initiative, a regional mental health initiative. So we work very closely with our community. So all 6 of us MIFs, Minnesota Initiative Foundations, participated in this grant program that I'm going to be telling you about. And besides the grant program that we had, the state also has, Minnesota State also has a grant program for, it's called the Peacetime Emergency Childcare Grant, and that is through Child Care Aware of Minnesota, which is a little different. They have more money that they'll be giving out to providers than the MIFs did. But the MIFs had money or got money from private philanthropy from the Minnesota Council on Foundations. And then we had our own funds. And then West Central Initiative had some funding from the Department of Employment and Economic Development that we had previously received from them for child care capacity building. And they allowed us to use that money for the child care emergency grants. So West Central Initiative had a total of $200,000 to disperse, and we gave out around 175 grants, and we had double that number that applied that we were not able to fund. So the funds were for any expense childcare providers have that will help them stay open to care for the children of essential workers. The funds were for licensed family childcare and licensed childcare centers in our 9-county region, including a portion of the White Earth Nation. The funds were distributed on a first-come, first-served basis, and we also made sure that each county and White Earth had programs that were funded. Each family childcare provider was eligible for $1,000, and we just put it at $1,000. We didn't go up to, we just gave everyone $1,000, and each center was eligible and got $3,000, the ones that were funded. So these funds were made to go out the door quickly, to give some immediate help to providers, and to also give some hope to providers and the sense that they are appreciated. We knew that $1,000 or $3,000 was not enough to keep anyone open for a week or so, but we wanted to make sure that they knew that someone was trying to honor what they're doing and really cared about them. So the applicants all need money. The bottom line is they need money. They also need support. We had many providers call to talk to us, to vent, to cry, just to be heard. So besides money, our child care providers really need support. And that didn't happen as much beforehand as it should have, and it definitely isn't happening as much during this crisis as it should. We do have, in our region, we have a grant that pays for a child care supporter, but there's definitely a need for more than that. What are the funds being used for? We don't know. We didn't, it wasn't enough money for them to report back on, and it's too busy a time for them to report back to us. And it just really was not enough money to ask people to say what they used it for. And what else do they need? We're working on connecting with local grocery stores to have them give preferential treatment to providers when purchasing cleaning supplies, toilet paper, and paper towels and other things. Somebody asked for infrared thermometers this week. We're also working on getting hand sanitizer and bleach to them for free. Our partners are Child Care Aware of Minnesota and our regional Child Care Aware. And then what are we finding that the benefits and limitations of this strategy are? And again, it's not enough money by any stretch of the imagination. Besides financial assistance, providers need emotional support to get through this. This was a broken system before, and the COVID-19 crisis has just exacerbated the problems of this broken system. And to be totally honest with you, I did some soul searching when it came to these grants, because I knew it wasn't enough to give people, there wasn't enough to give each individual person or center enough to keep them going for a long time. And it wasn't enough for everybody. So there were people we had to say no to. And so I really did soul searching about that. Should we still do this, even though we know that? And I came to the conclusion that yes, we should still do it. It's helping people. And it's also really giving our providers a message that you're not out there alone. We care about you. And we're also trying to seek more funding to give out to you through West Central Initiative, and we're also doing a lot of advocacy work on a state and national level to get more funding to childcare providers. Thank you.
Thank you, Nancy. And I really, that was really helpful to me. I'll just say personally to you know, the humanitarian response aspect of that, because I think, I'll just say for me, I'm more of a policy wonk, right? And so I'm sitting there thinking about how do you manage this market and how do you put money in and capital in ways that are going to, you know, I just really appreciate what you said. It really helped be a check on me. And I've had some conversations with Natalie over the past few weeks, and I think that it's a perfect natural place for Natalie Renew, from the director of the Homegrown Initiative, to talk about the Homegrown Fund for Home-Based Childcare, because I think you know, many philosophical points that we've talked about, Natalie and I. So Natalie, go ahead and take it away.
Thanks, Shannon. It's a pleasure to be here with you all. Homegrown is a collaborative of 10 national funders from across the country, many of whom are on the call today. And in response to COVID-19, our funders made a decision to establish several programs to support the home-based childcare sector. We are really inclusive of a variety of home-based providers, both licensed family childcare, family friend and neighbor, and other licensed exempt providers. And in response to the crisis, we first established an emergency toolkit with our friends in Philadelphia, the Reinvestment Fund, who Rashonda and Elliot just referenced, and really sort of laid out a set of tools for local communities to use as they think about establishing emergency funds on behalf of home-based providers. And then to sit alongside that, a group of our funders, Heising Simons, Klingenstein Philanthropies, Mavis Social Capital, Imaginable Futures, the Packard Foundation, and the Pritzker Children's Initiative established our National Emergency Fund, which provides funding to local communities that use the toolkit to create local emergency funds on behalf of home-based childcare providers. We hope to make grants of up to about $100,000 to 10 to 15 communities. We will be granting to intermediaries that have relationships with home-based providers and can quickly deploy those dollars to providers in their communities. Our hope is that communities will use the toolkit and identify existing intermediaries with relationships, but other leverageable assets to administer the programs. So folks who already have financial systems in place to support family childcare providers, folks who have staff and electronic accounting systems and things like that to support local communities. A sort of key feature of both the toolkit and of the emergency fund is that local communities are engaged in needs assessment and collecting data directly from providers to inform the design of their fund. And that, you know, given the circumstances in each community and the profile of the providers being served, we envision that the funds will look quite different across the country. You know, and I think we're starting to see with the applications that are coming in communities where there are large numbers of providers who are serving the essential workforce. A lot of the needs for the emergency funding are around supplies and materials to meet, you know, ongoing operating needs. In communities where providers are closed, a lot of the need is around income replacement and thinking about reopening expenses. But we really want those decisions on how the dollars are used locally to be driven by provider input and community needs assessment and sort of stakeholder engagement. We envision at Homegrown, we will support, you know, 10 to 15 funds, and that there will be other funds across the country that are using the toolkit and supporting this group of providers sort of in solidarity, like in Philadelphia, where there is a fund in place that is serving this community, and that we can convene funds and provide some community of practice and shared learning and support to the various funds that are focused on home-based providers. And in terms of prioritization within our fund, we're really interested in working with intermediaries and their funding partners in places that are really hard to reach, and particularly with hard to reach populations and provider populations. So are prioritizing communities that work with family, friend, and neighbor providers. We hope to see geographic diversity in our funding pool. We want applicants, again, who can leverage existing infrastructure and relationship to manage and deploy the funds. And we also really want to see how local communities can link their funds to sort of a bigger picture around policy and sustainability. We've been really excited with some of the applications that we've seen that have come in, where the fund administrators are thinking about how to connect emergency funding recipients with shared services alliances and QRIS and other sort of sustaining infrastructure. And that's particularly exciting, but also really don't want to lose the opportunity to gather data around the experiences that providers and caregivers are having right now, and reflect on sort of what they tell us about the systems that were in place that, and the issues that were in place, but also what ongoing needs are for continued advocacy and movement building, and really sort of sharing the stories of the experiences that caregivers and providers are having right now. Yeah, and I think one of the things that I would also just say in terms of sort of some of the benefits and limitations, I think one of the challenges that we've seen, particularly during the COVID-19 response, is that the infrastructure that supports family providers and caregivers is really disparate, and in some places is really strong, and in other places is really decentralized. And providers are really struggling to access financial resources, to access information, and you know, many of them don't have sort of trusted partners and a community of support. And I think one of the opportunities that we see or hope to see is that some of the infrastructure supported through these funds can start to build some of those relationships, particularly in communities where that infrastructure does not currently exist. So with that, I will stop and look forward to answering any questions in the discussion portion.
Thanks, Natalie. I appreciate that. So I'm really pleased and honored that we have Ai-jen Poo, the director of the National Domestic Workers Alliance, with us to talk about their Coronavirus Care Fund. And before Ai-jen starts, I want to say, I think that we typically have focused on a more formal childcare sector in this group as Early Childhood Funders Collaborative. Even, you know, we have an emphasis on home-based care, many of us, but thinking of licensed home-based care in the provider's home as opposed to folks who go into other people's homes to care for kids. And one reason why we thought it was super important if Ai-jen or one of her staff had the time to join us is we've been working at ECFC to put more of an equity lens on our work. And when you look at the group that we've been leaving out, quite frankly, in a lot of our work, and that some of the public responses are leaving out, I think there's a big overlap with the families and workers who are being left out of our public sector investments and the group, the membership of National Domestic Workers Alliance. So Ai-jen, we're really happy to have you talk to us a little bit about what you're hearing and what you all are doing to try to address this.
Yeah, no, thank you so much for having me and for including domestic workers in this conversation. It's so important, and we are all part of a care economy that is underinvested in and undervalued, and we have an opportunity to change that, I think, in the midst of this crisis together. So at the National Domestic Workers Alliance, we represent nannies, house cleaners, and home care workers, basically the workforce that cares and cleans in our homes. And ever since the COVID crisis took hold, we have been in rapid response mode, trying to respond to what is an unprecedented and profound crisis in our community. The women who do this work, as you know, are overwhelmingly women, and disproportionately women of color and immigrant women. And domestic work is the industry within our US workforce that has the largest concentration of undocumented workers who work. So large numbers of undocumented immigrant women. And they really have been first responders in the midst of this crisis. There are nannies who are taking care of the children of emergency room doctors and public health officials who are working around the clock. And there are house cleaners who are being dispatched to clean hospitals and nursing homes. And there are home care workers especially who are guardians of some of the most vulnerable people to the coronavirus, including people with chronic illnesses and older people. And before the pandemic, as I'm sure many of you are familiar with the childcare workforce overall being so undervalued, domestic workers earned poverty wages. It was very much a paycheck to paycheck life and did not have the savings to do things like stock up on groceries and supplies, for example. There are no paid sick days. 82% of domestic workers have not a single paid sick day. Or paid family leave, or access to benefits, or any kind of a safety net, really. So as all of us started practicing social distancing, it just meant that domestic workers who weren't working, either because they had lost their jobs and were told not to come, or because they wanted to stay home to help slow the spread and flatten the curve and also take care of their own families, were faced with just an impossible set of choices. And it really did mean the loss of income is literally resulting in the inability to put food on the table for your children, the inability to understand how you're going to keep the lights on or a roof over your head. I spoke to one of our members this week who described the food left in her refrigerator as half a carton of juice, half a loaf of bread, and a carton of eggs. And most domestic workers, like many childcare workers and early childhood educators, are primary income earners for their families. And so just thinking about and we are only a month into this, right? And as unemployment numbers soar, it's the families who employ domestic workers who are now applying for unemployment. So the domestic workers are not even on the radar of those numbers. And so it's just thinking about how the crisis is going to deepen as the weeks go on. And then there's a whole set of challenges for caregivers who continue to work and try to and figure out what that means in terms of keeping yourself and your own family safe and healthy while providing a lifeline to other families. And so we're hearing stories about caregivers, nannies who are quarantined with the families that they work for away from their own children and families, who are being cared for by neighbors, and all the while not being defined as essential workers. So working without appropriate protective equipment, access to testing or any kind of care. And so it's just a really challenging environment. And in response to the urgent need, what we've done is we've launched our Coronavirus Care Fund to provide emergency assistance in the form of $400 Visa gift cards to domestic workers in need. And we've also recently been approved for PayPal, so very soon domestic workers will also have the option of getting the assistance via PayPal. And the way we were able to stand up this fund so quickly is basically before the pandemic, we'd spent 4 years developing a portable benefits platform called Aliyah to enable domestic workers to get access to benefits like paid time off that they currently didn't have access to. And we took so much time to design the platform to ensure that we were designing for the hardest use case, the unbanked, potentially undocumented worker with multiple clients, right? The most kind of complex use case to design for was who this platform was designed for. So it meant that in the midst of this crisis, we could actually deploy a big part of the platform to service the care fund very quickly and begin to administer the relief. So far, more than 85,000 individuals and institutions have donated to the fund, which has been one of the things that keeps me incredibly hopeful in this moment, is just the incredible generosity and kind of compassion and action that people have taken. And some of our institutional funders include Heising Simons, Robert Wood Johnson Foundation, Omidyar, Open Society, Blue Meridian, lots of institutional funders as well. And the combination of both everyday people who've contributed online and anchor institutions has just been a wonderful way to say, okay, we're in this together, and we're all going to come together to make sure that the people who care for us are able to take care of themselves in the midst of this crisis. So right now the fund is serving people who are already connected to our community because of the verification issues. And we just launched a few tests this week to begin testing a third-party verification process. So we should be able to open up to a wider group of applicants soon, but there's a universe of over 100,000 domestic workers who we know and can easily verify. So that's who we began with in the circle. And we're continuing to scale. We've issued more than 2,000 payments so far, and every week we are able to scale exponentially. And our understanding is that the money is being used for food primarily, and in some cases other basic household supplies and essential transportation, for example, to get to the grocery store. And as much as we're able to raise, it's not going to be sufficient to meet the need in this moment of crisis. And so advocacy has been a huge part of our response work as well. We really do need bold action on the part of federal, state, and local government to ensure that relief efforts are inclusive and really understand the significant role that caregivers, women, and other vulnerable populations are playing in this moment, and really uplift and center how we support them. So we've supercharged our advocacy efforts, and this week we're focused on pushing for an essential workers bill of rights that defines who is essential very broadly to be inclusive of caregivers, and making sure that the essential workers who are working right now actually have access to childcare and dependent care supports themselves. And I do think that if we do this work right in the short term, that there is an opportunity to really position investments in our care economy as central to how we recover as a country from this crisis. And so we are starting to plant those seeds as well, as really seeing this moment as an opportunity for organizing and really bringing in and engaging all the people who are seeking relief in this moment of crisis, to see that being connected to organizations like ours is also a resilience strategy. It's about long-term change, but it's also about the fact that no matter what will come, that being connected to a community that is trying to improve life and work in our industry is in some ways your best protection, and ultimately a resilient strategy in and of itself. So I'll leave it there for now.
Thank you. I really appreciate that. And really, I think one of the things that I've been thinking about and that your fund highlights so well is how we can connect movement building with direct support for people. Several people mentioned that, but I think that your coronavirus care fund really underscores that. So if you have a question, we have 15 minutes for questions. You can chat the question, and we can then call on you to unmute yourself. You can also do raised hand if you look inside the participant box, but I think it's almost easier if you chat the question. One question that I had for y'all while we get going a little bit is, if if there's anything else that, and some people touched on it more than others, in terms of equity and thinking about who's getting support. I talked to some expert this morning, and we talked about the fact that big multi-network childcare providers may suffer, but they're likely to survive. Small women-owned businesses, minority-owned businesses are less likely. And in fact, we also talked about the fact that infant care providers are less likely to, the market disadvantages them, right? So if we don't do something specific around that. But when you think about equity in terms of who your funds are reaching, given the first come, first serve and the speed that everybody's trying to get out, how are you thinking about not having that reinforce the idea that the best positioned people get in first?
I can respond to that. In our region, we made sure that it went, the grant application went out electronically as well as in the mail.
Oh.
And most of our family childcare providers, so I think we have between licensed centers and family childcare providers, I think we have 520, something like that in our region. And we had over 400 apply. So I think we've reached pretty much everybody. I can't say that for sure, but I think we did a good job of that. And we have contact through our early childhood initiative coordinators in each of the counties who work directly with all of the licensed providers, centers, as well as family. Now, we didn't fund family, friend, and neighbor providers. They aren't licensed, so that is a sector that we did not fund. So that would be something that, we need to look at.
For us, we work through, we have over 70 local affiliates and chapters around the country who every day work at the grassroots level, serving vulnerable populations. And we really worked through them in terms of getting the word out and being able to identify and target people for applications to apply. So each of our affiliates were given a series of unique codes to give to domestic workers who would apply for assistance, so that we would know that the people who are applying had been pre-verified. So that we really trust our local partner organizations to identify and determine with an equity lens the need.
That's super helpful. And that actually leads to a question I had for you, and then I'm going to start. We've got a lot coming in the chat. We have a lot of state and local funders at ECFC, and of course there are community foundations and United Way and that kind of thing. Is there a way then, since you use your local networks, to target contributions to a geography within your fund? Oh, I'm not sure if you heard me. Did you hear me, Jen?
Sorry, could you repeat the question?
Yeah. So we have a lot of state and local funders that we interface with, and United Way and community foundations. Can people target a geography since you have those local networks?
For sure. Yeah, many have.
All right, so I'm going to go to the chat box because there are a lot of questions. So Aaron Swatolsky, if you would like to unmute yourself, I can see you actually, but I think it's easier if you unmute yourself. And you had a question for Natalie about intermediaries.
Yeah, and this could apply to anyone, but I was curious what types of agencies are serving as the intermediaries. I think one of the things that I'm struggling with is we have, it seems to me that we have really limited infrastructure that is connected to home-based providers in the state. And so I was really curious about what kind of entities already exist that I could potentially reach out to.
Sure. So I would encourage you to take a look at the toolkit as well, because we have a section on sort of who might serve as intermediaries and some guidance on selecting intermediaries. We envision that intermediaries could be CCR&Rs, shared service alliances, and staff family childcare networks that maybe typically provide professional development or other types of supports. I think in an environment where some of those may not be in place, a place to look might be CACFP sponsors and organizations that distribute other types of state funds on behalf of home-based providers, or cultural or social service organizations that may work with this population of individuals. So I think depending on your context, you may need to look around, but we do have a fair bit of guidance in the toolkit on some places to start.
Thanks. So I see there's sort of two questions about how the funds that y'all are working on interrelate to federal sources. So I'm just going to try to aggregate these. One is about essential employee care and federal resources and how to align private giving with those federal resources. And the other is sort of a different way. There's how private funds could align to draw down or to more federal funds or to fill in gaps around federal funds. And then Eva had a question about whether or not states are reaching out to y'all saying, hey, could you distribute some of our CCDBG funds that we did get back out, using you all as the distribution vehicle? So I think first let our speakers have a chance to answer that if relevant, and then I know there are representatives from other funds, Connecticut, Vermont, there's a bunch, and so we can pause and see if other people have answers to that too. But first, any of our speakers have a comment on that?
I can comment. The MIFs, the Minnesota Initiative Foundations, work very closely with our Department of Human Services, Education, and Department of Economic or Employment and Economic Development. So they often look to us to give us funds to do projects out in our rural regions. And so we have a really good relationship with them. And I don't know if this is really the right answer to a question that you had, but we also work really closely with our family and center providers. We give free trainings to them often, and our center directors meet in our office once a month. And because they can't meet there, we gave them a Zoom account. And that's a really little thing, and they were so thrilled to be able to have that, because no one could afford even I don't know how much it cost, but no one felt at this time that they could even afford that. And so they've been meeting once a week through this crisis, and it's really, really helped them to support each other. So sometimes we can do things without lots of money to be helpful.
I would just add a couple of things from our perspective is that we really advocate strongly that the funds in place have both this community needs assessment infrastructure where they're gathering information directly from providers to understand what their needs are and how they change over time. And so this is how you would sort of establish if providers are having challenges accessing some of the federal stimulus benefits. As we've heard from providers, their ability to access the small business loans and things like that has been really strained. And that data can really drive an agile fund to make some adjustments. So perhaps dollars need to be redirected in the case of Philadelphia to a technical assistance support to help providers connect with those resources and things like that. And we also really strongly encourage a stakeholder engagement strategy with the funds that really helps with the full deployment of all the community resources. So how can the fund be a link to other technical assistance, to other funds for, individual, there are these other relief funds and other opportunities to get folks connected with unemployment. So I think that kind of community needs assessment and then this really broad and rich stakeholder engagement can help drive some of that agility in a fund.
Elliot, I had seen you were unmuted, so did you? Yeah.
Yeah, thanks. I just wanted to echo that I think that the fund can't be seen as the solution or a standalone piece, right? And so in the case of Philadelphia, that hotline that Rashonda referenced that supports individual providers to access some of those public funding sources from federal and state and even local grant and loan funds that are available, is part of this effort, right? The repositioning fund that you mentioned also. And so providers are referred either direction, right? If they call the hotline, they're referred to this as another source of funds. If they apply here, they're referred to the hotline for additional support to apply for other funds that may be out there. The other thing I would say is that this fund, which now, you know, stands at a little bit above $7 million, every month in Philadelphia, we know that $3.3 million in co-pays are not coming into providers, right? So that's every month. So this fund will not sustain providers at this time through what we know the closure to be, you know, through the end of this school year in Pennsylvania. And so it has to be viewed as just one leg of this stool. And so another piece of it is that after providers are awarded funds through this, they are connected and given the option to connect with advocacy organizations, because to your point earlier, Shannon, part of this is going to be advocating for the sector, so that those much larger and ongoing needs, which no philanthropic fund can support, will be met through some other vehicle.
Yeah. And Elliot, well, there was one other question here that really struck me as well. Eric Buchanan from Buffett had a question about Rashonda, maybe, I think, referred briefly to, like, people are being asked, like, do you think in the long run that a merger or being part of a network or, you know, might be a more viable business plan for you, consolidation? I mean, that's pretty forward thinking. And so a question about how that would work. You said then they'd be channeled someplace. So Rashonda, I see you unmuted. Maybe you want to answer.
Yeah. We already in place, we've been thinking about what a repositioning fund for nonprofit early childhood providers would look like, nonprofit and for-profit. And we're right at the beginning to pilot something with hubs of providers across the city who might be interested in working together. As a result of this crisis, we then shifted that work to really respond to a very direct question on that application that says, would you be interested in thinking more about what repositioning might look like as you reopen, as you come back to the table? So and I don't think we've had anybody who checked that box yet, but if we do, right, those are the people that are going to be sort of routed into that repositioning fund work, which already has dollars on the table, ready to begin to pilot some of this work with providers in the city.
Thank you. So I'm looking, and we're at time, so I want to say a couple things. First, I want to thank everybody. I know we picked 4 folks to talk this week, but this was actually inspired by several weeks of peer sharing calls with people talking about their funds. And the other thing that has been really helpful, and I wanted to let you know what we did. Last week, we had a peer sharing call with funders, and y'all started chatting in the chat box about how quickly your funds were running out and how many applicants you were having more than you could reach. And so when we saw that, we reached out to some of the advocates in DC and said, would this data be helpful to you on the Hill? And they said, yes, it would, but we're super busy. So Rachel Schumacher, consultant to ECFC, is going to be reaching out to those of you who've told us you have funds. We're not doing, it shouldn't take a lot of your time. We want to know, like, just stuff that we can aggregate. How much did you have? How quickly did it go? What was the need you couldn't meet? And we're going to try to quickly kind of compile that and get it to our friends who advocate on the Hill. And so, like, just illustratively, the Nebraska Child Care Provider Relief Fund already shared with us, right? They had $450,000. They had 1,200 applicants. They gave out $1,000 each. They could reach 450. You know, that's way less than half that they were able to reach. And so we're going to, if you have funds that we haven't captured on our website, please send them to either, we'll make it easy, send them to me, shannon.rudisill@ecfunders.org, or rena.large@ecfunders.org, and we'll get that info to Rachel. She might reach out to you and say, hey, could you give me this info? Because we don't think that window is very long, but if we can capture some of it, we want to do our part to help. And I think this was a really great opportunity to learn about the way that this short-term strategy is linking to longer-term strategies, both for advocacy, for movement building, and for sustainability of the sector. So thanks again to Celine and GFE for co-sponsoring with us.
Thank you all, and that sounds like a brilliant thing to do, Shannon, so good for you for that advocacy. So thank you all. This was great learning for me.
All right, everybody take care and be safe.